Welcome to your last module. We are so close to the end, so stick with me as we get through these. Again, I'm going to go through all three of your options to see which one you would like to do. And of course, if you have any more questions after these, just let me know and I will explain them to you. So without further ado, let's get into our three. So we have dark science, we have healthcare resources and pandemic, and then we have reproductive technology. So this is a really fun one. It's really interesting. I think you guys are going to like it. So let's go to the first one. So this one is human research, consent and coercion. All right, so for this one, the case that we'll talk about primarily in the chapter is going to be the Tuskegee Airmen experiment, which was an atrocity in the medical community when it came to consent and coercion. Now, this is the one the chapter uses a lot to reference to because it was one of the most, outright abuses of consent. But for this particular assignment, what I want you to do is to read through the chapters, and I attached some videos for you. I want you to have a little bit of freedom this week, so I want you to go into the chapter and review some of the cases under cases for evaluation. There's quite a few that you could pick from, and I want you to discuss a few things about it. So after you pick one of your cases, how would it interact with one of our moral theories? So just like we've been doing so far, we have the natural law, John Rawls, utilitarianism, deontology, virtues. So with the case that you picked, first we need to identify, what was the violation? What was the case? What's the ethical dilemma? And then, which one of the theories did it violate? Which one was it in line with? So again, you're just, sifting these medical dilemmas through our philosophical moral theories. And then, this one right here is the second one. Regarding the Tuskegee Airmen, what are your thoughts on balancing all of this? Now, as atrocious as this situation was, the medical community cannot deny the data that came out of that experiment. And historians and the medical community will debate vigorously back and forth. There was nothing to extract that was useful, and then there was everything to distract that was useful. You're never going to get a consensus on the outcome of this situation. So after you've read about all that, I want you to go through and I want you to talk about what your thoughts were on it. There is an optional one right here. This is for someone who may be a current medical profession. We would love to hear your experiences if you've ever dealt with a situation when it comes to human experimentation when they didn't know what was going on. So that's for the first one. So for the second one, again, this is one that you have a little more freedom to do. This one is about healthcare resources. It is a cold fact that we have way more people in need of medical care than we have resources. So there's a lot of ethical questions that come into play. First question should be, should the medical profession, should medical inventions, should medical resources and medical cures and treatments and prevention be nonprofit? Meaning that it is at cost. And that's it. And when it comes to overhead and supply and operations, the government picks up the tab. So this is a big philosophical question that we ask. So for this week, what you guys are going to do for this option is I gave you a handful of things here. This is the actual chapter that we're kind of coming out of right here. And I try to find some other articles that have kind of the same topic, but I want to stress you are not limited to those. So first one is using the articles in the material section as your guide. Which would you like to discuss and why? So I want to preface that with, this is our guide, but if you know of another situation where we had limited resources, X amount of people, and someone was going to get left off the table, you're free to bring that over. We just want to kind of stay in the scope of the topic. So we want you to pick one, discuss which one and why, and then I gave you a scenario. In this scenario, there is a rare and experimental treatment for a life-saving disease is available, but there's only enough for one patient. And I give you a scenario to kind of walk yourself through. So the first part, question IA, kind of gives you the freedom to just discuss healthcare resources on your own terms. And then as question 2, I've kind of given you a little scenario to play with. So this is an option, and this one actually is not such a bad one. If you want to dive into this one. Okay, so this is more of a science fiction one. But for some countries, it's a science fact. So see what I did there? All right. So in this one right here, you're kind of playing, I guess, scientific doctor. I've given you a scenario down here. So for this one, this is your scenario. You're in an overpopulated world with many children that are unable to receive proper care and nourishment. It seems incredulous to use modern medicine to create even more children. And when preventable diseases cause many deaths, is it not a misallocation of priorities to develop costly techniques for addressing this relatively less serious issue of infertility? So basically what they're saying in this one right here, this one was taken out of another article. It's a little wordy right here, but basically what this is saying right here is you live in an unpopulated world and you don't even have enough resources or staff to take care of the adults and children that you currently have on your planet. But we have IVF. We have people who would like to have a child grown of their own. So we have technology available where they could use IVF to create another human. But we currently live in a world where we have too many humans and not enough resources for the ones that we have. So is it irresponsible of us as a human race to allow technology to move forward that doesn't solve the problem for the humans already here? It is irresponsible for us to allow technology to continue that would increase the population without solving the resource problem. So this was an interesting scenario that I found in one of the medical magazines, and I thought it would be a fun one for us to talk about in our healthcare resources section. So for this one is read through the prompt and read all of this. There's it talks about it specifically a lot in chapter 8, and then for your writing prompt right here, it's 2 to 3 paragraphs where you're talking us through the situation. First, clearly state the problem. Go through your analysis. Try to answer these questions in your notes, so when you come here to present your findings, you're answering these. And then select the best solution you think to solve this problem. So, and then you offer your recommendations. And you're basically walking us through your take on this from not an opinion base, a philosophical base. If you were in charge of the planet, how would you solve this? How would you solve problem A? Too many people, not enough resources. And problem 2 is we're adding to the population without taking care of problem 1. So we're asking you, dear leader, what do we do? So that's what this prompt is about. It's a fun thought experiment. If you have some questions, let me know. And if you need more explanation or help, I'm obviously here for you. So good luck with your choices. This should be a fun module to see what everybody comes up with.